Temperature clean up. Hello everyone, good afternoon again. I am Dr. Das from Freeport Medical Center, and I am going to start our live video this afternoon. As usual, on Monday afternoons we usually do a live educational video presentation to all our Facebook friends and followers, including our patients, all our followers from out of Trinidad and within our country who are following us. And I must say we have quite a lot of followers. In fact, our last presentation on fibroids attracted over 27,000 views, and you know, the views keep on building up as time goes by. So I have to say that this presentation is really attracting quite a lot of attention. So we have made a decision to continue our educational drive and to continue to present information to all our patients and followers on very relevant and important medical topics, so that they may be aware of their problems and they can make the right decisions in looking after their health. Before I go on to our presentation today on arthritis, I would like to say that as part of our presentations, we have been also teaming up with the PTA at the Presentation College, where we are having we are having a health booth at the Presentation College PTA days today and tomorrow, and it has been quite a great success, where we are doing wellness testing of blood pressures, blood sugars, counseling the parents and also the students. So today has been a great success. We have been able to see over 200 we have had over 200 visitors visiting the booth at the Presentation College PTA and Parents Day today. So I like to invite some of the parents who might be attending tomorrow to look out for our booth, which we will be there tomorrow as well. In addition to this, on Wednesday I will be also giving a lecture at the parents at the Presentation College. It's on Wednesday between 10 and 12. Giving a lecture on the career day on the medical field. I will be speaking not only about the doctor, but I'll also speaking about nursing and all the different fields in medical technology, etc. So I would like to invite all the students who are looking on to come to my lecture on Wednesday, which I will be talking at the career day on the medical careers in the medical field. Okay. As well as today, I would like to say that arthritis is the topic. It is a very common problem, and I would like to break up this, divide this topic into two presentations. The presentation today will be focusing mainly on osteoarthritis, and the next week presentation I will deal with rheumatoid and gout. So it's a very big, very wide topic, and I would like to let you all know that it will not be possible to cover the entire topic of arthritis in one presentation. All right, I'm seeing Shanti logging on. Hello Shanti, and Tina as well too. Hello Tina, welcome to our live presentation today. Arthritis, it's something which we see very commonly, and more specifically among the elderly patients. So a lot of times the elderly patient will come to us complaining of pain in their hands, or lower back pain, or knee pain, or pain in their hips and ankles. These are the common areas that you will usually get the effect of arthritis. And when you examine the patient and you interview them, they would say that they did not get any, there was no trauma, there is no infection, and the pain started off spontaneously over a period of time, and it's getting worse over time. That is the general scenario that usually would be the case with osteoarthritis. This, before I go specifically to osteoarthritis, arthritis generally is a condition in which there is damage to the cartilage in the joints, and as the cartilage gets damaged, it can also affect the joint surface, the surface of bones and the joints. So obviously, if the cartilage is starting to get damaged, then there will be inflammation of the joint. So therefore, there is inflammation due to damage to the cartilage and the surface of the bones. That's the definition of arthritis. There are many different types of arthritis, and arthritis can come about primarily due to diseases that affect the joints alone, or it could come about due to other diseases in the body that can secondarily affect the joints. Some of the primary causes of arthritis would include osteoarthritis, which is the most common type, rheumatoid arthritis, which is an autoimmune type of disease, as well as gout, which is an arthritis that comes about due to acid buildup in the body. And then you have secondary type of arthritis, which comes about, for example, diseases that affect the other parts of the body and then also affects the joints. For example, psoriatic arthritis. So patient can have psoriasis and eventually come to us as finished physicians for joint pain and swelling. Alright. Or you could also have lupus, which is another disease that affects other parts of the body, for example the skin most commonly, but it would eventually affect your nails and your joints, causing arthritis. So these are some of the causes of arthritis, and of course because the topic is so variable and so wide, today I will speak mostly about osteoarthritis, and next week I will deal with rheumatoid and gouty arthritis. Alright, so in terms of arthritis, it is a very common disease. It affects mostly the aging population. So it's a disease of aging. As you get older, eventually everyone will get arthritis. Generally, in terms of world statistics, it affects 350 million people worldwide. So as I said, it's very common, and it affects, of course, the elderly, mostly the elderly patient. In terms of osteoarthritis now, we only have the statistics for the US, and from the American Academy, the US statistics would be arthritis would affect at least 50 million people in the US only. And out of the 50 million people, it has been said that 20 million people would have arthritis so much that is affecting their work. So the arthritis, sometimes you just get minor pains and swellings, but when it becomes severe enough to affect your work, the statistics in the US is 20 million people have arthritis that bad that it affects their work. Alright, so generally when you have arthritis, you would usually present to the doctor or will have the following symptoms, and these include swelling and painful joints. Swelling and painful joints. In terms of the joint that I'm speaking about, osteoarthritis, as we have said we're going to focus on today, it will usually affect the hands, the joints of the hands, the shoulders, hips, knees and ankles. It can also sometimes affect the spine, so you get lower back pain, and you sometimes get it in your wrist. So we also have some patients getting arthritis in their neck as well too, the spine and the neck. So these joints will be swollen, and we see quite a lot of patients coming with swollen knees, swollen fingers, etc. Sometimes the joints will be discolored, so it becomes a little bit reddened. It may have a fever, because sometimes when we feel the patient's skin, there is a fever in the joints. And of course, when all of this happens, then the patients will have difficulty with moving the joint. Alright? So you have swelling, you have pain, you have discoloration, may have a fever, and of course difficulty moving the joints. Alright? How is this diagnosed? Well, arthritis is generally a diagnosis made by the doctor after the doctor interviews the patient and examines the joints, and of course he would then also order an x-ray of the joint, which will show the different problems. As I said before, is usually patients in the older elderly patient. The arthritis will usually start off as a slowly progressive disease and gets worse with age. It usually affects women, female patients a little bit more than males, so you may get like a 60-40 ratio, 60% to 40% ratio between female patients and male patients. It may affect patients who are overweight more than patients who are within the BMI, and it will affect patients who have joint who have had trauma to their joints, or joint disabilities. If they have congenital abnormalities of the joints, for example, that would be a precipitating factor for arthritis later on. All right. Also, if you have had an infection or so in the joint, that will cause the arthritis to come on faster. All right. So the doctor will look at all of these points, and then he would, start making a diagnosis. And then on examination, when the doctor examines the patient, he would find the patient has problem moving the joint, and of course there may be deformities of the joint, so the fingers may be twisted towards the ulnar side of the hand, of the forearm. There may be swelling of the joints, pain, fever, etc. Sometimes patient may have an effusion. An effusion is where fluid, extra fluid, which we call synovial fluid, builds up in the joint and causes the joint to swell tremendously, and that type of effusion causes extreme pain. And on examination, again, the patient will have a fever, and there will be, of course, difficulty moving the joint. So if it's a shoulder, for example, the patient will not be able to elevate the shoulder or extend the shoulder or rotate the shoulder, as the case may be. All right. In the case of those patients and elderly patients, the doctor would order some blood tests, and these blood tests would consist of what we call tests to check for inflammation in the blood. So we check for the ESR, we check the complete blood analysis, we check the C-reactive proteins, we also check for rheumatoid profile, we check for acid in the blood. Alright, sometimes if we're thinking that the patient may have lupus, we check for lupus as well. We check for the rheumatic factor. So there are quite a lot of tests that can be done and has to be done in the case of arthritis, especially if it's a younger patient, because we are saying that this is a type of progressive disease and it affects elderly patient. But if a young patient comes in to see the doctor, we will have to be much more thorough and not trying to make sure that there is nothing precipitating underlying disease causing the problem. An x-ray will be ordered, and when you order this x-ray, you will be looking specifically for changes in the joint, because we know that the arthritis is going to cause cartilage damage. So if the cartilage is damaged, the space in the joint will get narrower. So as a doctor, we know how wide the joint space is supposed to be. So we'll be seeing a narrowing of the joint space. Alright, we will also be looking for cyst changes, sclerosis, and we will also looking for damage to the joint surface. We will obviously also be looking for something called osteophytes and spurs of the joints. So there are lots of things that doctors look for in an x-ray to see if there are arthritis changes. Alright, I just want to say hello to some of our other Sudha is logging on here as well too. I see K, that's K. Right, hello and welcome to our live video this afternoon. With regards to the progression of the disease, if it's not treated, it's going to get worse, and the joint itself becoming inflamed will damage what we call the synovium, or the covering of the joint, called the synovial, the covering of the joint, which is due to cartilage and ligaments. And there can be the joint will release fluids, and sometimes this fluid is very inflamed and can cause even more problems. So it's a spiral effect if it's not treated, and eventually sometimes even treatment, a lot of times treatment, when the joints get very bad, some of the treatments will not work. So then how do you treat this problem? So now that the diagnosis has been made, there are different ways to treat this arthritis, but generally speaking, we will start to talk to the patient about therapy, about exercise, physiotherapy, trying to get them to strengthen the muscles and the ligaments around the joint so that the joint does not get so much pressure. Of course, this type of therapy is not done when the joint is inflamed. So when the patient has pain, you're not going to exercise. You have to rest and use a medication to get the inflammation down. Once the inflammation is down, then you do therapy. Okay, trying to remove the flexion, get the patient to flex back the joints, etc. A very important aspect of treatment is trying to get the weight down, because remember, the weight on the joints put extra pressure on the joint. Hence the reason why you will find arthritis more common in the knees, the hips, the back, and the ankles, because these are the joints that takes the weight. So if the person is overweight, you have to make sure and you have to get them to drop the weight. And that will of course include a specific diet, which is low calorie diet, low cholesterol, low calorie, and also the patient has to start an exercise program. Okay, so that's an important aspect of treatment. In addition to that, we will prescribe some anti-inflammatory tablets, and there are many different types, of which I will not be able to mention today, but there are many different types of anti-inflammatory. So because, as I said in the pathology just now, that it's a disease that causes inflammation of the joint, you have to give anti-inflammatory tablets. There is also an anti-inflammatory injections that we use, that can be used to help with the arthritis. In some cases where there is effusion of fluid in the joint, the experienced doctor will withdraw that fluid from the joint, and it is very normal and acceptable to withdraw fluid. So I want you all to understand that a lot of times there's a misconception that if you remove fluid from the joint, that's a bad thing. Well, I have to inform you and educate you today and let you know that withdrawal of fluid from an inflamed joint
is the best thing you can do for a patient. They will kiss you and tell you and thank you. So they cannot finish thank you because once the inflamed fluid comes off, the patient starts to feel the relief and they feel better almost immediately. Once the fluid is withdrawn from the inflamed fluid, that is withdrawn from the joint. Sometimes, again, the experienced doctor can give an injection into the joint as well too, and that is an anti-inflammatory injection that you can use to help with the inflammation. And then there's another type of injection that we use to replace some of the synovial fluid if the fluid that you have in the joint has become damaged and it's not functioning and doing the job that it's supposed to do. Then we can replace some of the synovial fluid into the joint, and that also helps to give the patient some relief for a few months. So that's a good type of treatment. And if all of those don't work, then the patient will have to resort to doing joint replacement. In Trinidad, and I know outside of Trinidad it's much easier to get it done, but we are now doing joint replacement surgeries in Trinidad, and you can replace a knee joint, you can do hip joint replacement surgery, and in some countries you can also get shoulder replacement. So sometimes patients' shoulders, which has been damaged so much that it is not amenable to medical treatment, then you will have to take surgical treatment via replacement of the shoulder joint. All right. So in terms of treatment, that's the extent to which patient can go with regards to treatment. All right. So arthritis, again, it's very common. It's something that is inevitable. It's a progressive disease. Everybody will get arthritis. It's not something that you can avoid, and as you get older, it gets worse. All right. Osteoarthritis is the most common type of arthritis, and there are other types, including rheumatoid arthritis and gout, which I will deal with. Rheumatoid and gout, which I will deal with in my next presentation next week. So I'd like to thank everyone again for logging in. I would like to ask you all to keep on sending your questions. If there are any questions that you would like to ask specifically about arthritis, but if there is any question about any topic that you would like to ask, you can always send us a message on Facebook. Send the questions on Facebook, which we will be able to answer. All right. Remember that you should do an X-ray if you believe you have arthritis, to confirm it, and the X-ray is something which can be done on an annual basis to monitor the extent to which the joint is deteriorating, as the case may be. You can also have blood tests that has to be done, and all of these tests, including the blood tests and the X-rays, these are available at Freeport Medical Center. I'd also like to say that we have continued to run our specials on our CT scanning at Freeport Medical Center. So all patients who are interested in having a CT scan done, you can inform your family and friends that we are having our CT scan special running, which started off earlier in the year, but we continue to run it as we realized that there was a shortage of this service in the country, and we decided to come up and continue to run our services. In fact, we have became known as a CT scan specialist, providing this service at a very nominal price in Trinidad and Tobago. So, ladies and gentlemen, I'd like to thank everyone for logging in. I will be at Presentation College on Wednesday giving a lecture on on the medical opportunities and the career day, and our staff from Freeport Medical Center will be there tomorrow at the PTA booth for the Parents Teachers Day. So I'd like to welcome everyone, thank everyone for logging in, and to invite everyone who will be there tomorrow to go visit our booth at the PTA Day tomorrow. Thanks again, and bye bye. See you all. Bye bye.